Through this door is the most advanced technology that you will see. It's almost like science fiction. Come on, let's go check it out. Today we're here with Kathy from Medivet, and we're going to learn about all things stem cell therapy. Kathy, thank you so much. This is so fitting for Global Rescuers because we're expanding outside. And we want to talk about the stem cell therapy. You had a personal experience with your dog, so share, please.
We had a Labrador Retriever that was experiencing laryngeal paralysis, which is a condition that's unique to older Labradors, where their larynx actually gets paralyzed. And she went from walking 3 miles a day to she couldn't even cross the street without coughing, gagging, vomiting, and collapsing, basically. She just couldn't process the air. We didn't think that stem cell would work for her, but we tried it anyway because it couldn't hurt and it might help, and amazingly it did. So we processed the first set of cells, we harvested them from her fat tissue and had them just injected back in through intravenous fluids. And within 30 days, she was walking about a mile again. When somebody came to the door and rang the doorbell, she didn't collapse. She was able to just handle that encounter. So after about 30 days, we did some more of her cells, and we had cryogenically preserved some of her cells. There's a cryo bank at the home office in Kentucky, and we had them overnighted and put them back into her body, and just to do more repair work. And then by the end of 2 months, she was able to walk 1.5 miles. So I wouldn't say that she was a puppy again, but she was a highly functioning senior citizen, and she was our miracle dog. And that totally convinced us of the power of stem cell therapy. And so it makes it easy for me to talk to the other veterinarians and the pet owners who are considering stem cell therapy, because we saw it every day. Firsthand.
Right.
Yeah.
So if you had not had that technology available, what would have been the outcome?
Oh, well, that's why we did it, because she had an episode. We took her to an emergency room, and they said, you have 3 options. You can either tie back side of her throat permanently, but she'll probably choke to death on food. You can sedate her, so she'll lay around the house like a cat all the time, or you can put her down. And we didn't like any of those options.
No.
So we said, let's try it.
And what were one of the reasons why you weren't sure it was going to work? Because if I'm correct, stem cell therapy is usually for arthritic reasons in dogs.
Correct.
And is that the reason?
Yes, they highly recommend it for arthritis, for hip dysplasia, soft tissue injuries, cruciate tears, anything to do with the joints. Those are for sure that they work great. But unusual conditions like laryngeal paralysis, there hasn't been enough science, enough research done to this time yet to check it out. But they do have an opportunity to try these other conditions with what we call compassionate use, which means we don't know, you don't know, the doctor doesn't know, but let's give it a try, and everyone agrees.
Yeah, and it was better than the alternatives because the alternatives weren't good either, so why not try for something that may have that possibility? Now, I understand there's a doctor or a vet that did the first stem cell surgery or treatment.
Veterinarians, we're skeptical people. We're a skeptical bunch. We want to see a lot of science. We want everything proven to us, and this is a young science. Well, now I've had access to some of that research. I've done close to 100 cases. I'm seeing the results. I know when my colleagues see what this does for animals, they're going to want to do it too. So I want to share it. There's 150 million dogs and cats in the United States alone. We're estimating 25 to 30% of them have osteoarthritis. We can help that population of animals better than anything I've seen before. So I want to just convince them to try it in one animal, to select that case properly and try it. And then they'll be like me. They'll be wanting to tell the rest of the world about it, because now we have this new tool, regenerative medicine. And I can't tell you how excited I am about it. I know it's hard to tell. I'm not animated at all. But we're putting the body's own repair cells back to work. We're waking them up. They're sitting in the fat, they're dormant, they're sleeping, and the body would use them. Well, what the stem cells do, if we activate them and put them in a little bit sooner, they reduce the scar tissue, they reduce the inflammation, they repair, they'll turn back into cartilage. What we're doing in-house now with a stem cell kit that Medivet America brought to us is we're taking the fat out, takes about 10 to 15 minutes. We're then processing it in-house, harvesting the stem cells. We're activating those stem cells, which means we're waking them up from a dormant state or a sleeping state with some growth factors from that patient and some photostimulation from an LED light source. It's a patented technology. And then we're injecting them back into that patient. Very little risk of reaction because the cells are coming from that patient going back into the patient. And we're doing that in one day. It takes about 4 hours. More affordable, more efficient. I'm doing it in-house. I'm not going to have cell death. I'm going to be injecting them right away. It's a sterile procedure, and it's something that 80% of it my technicians can do. So I do the surgery. My technicians process the fat because you just need technical skills for that, and you follow a procedure that hundreds of millions of dollars produced, and we don't even have to ask questions. Brains smarter than mine develop these technologies that we can now do in-house, and then we can inject them, and I inject them back into the animal 3-4 hours later. The animal goes home the same day, the whole process is done.
We have a weekly webinar that all the doctors that use stem cell therapy, the Medivet protocol, they can call in on a Wednesday evening and share stories, ask questions, say, I've tried this, what was your experience? And what we're trying to do is expand the clinical knowledge across the entire country and even the world by doing that.
Right, and it should be that, because anything that's new, first off, people are going to probably put it down because that's just human nature, you know, and so I'm really happy that this is being brought to light. Now, I know that there's a huge controversy in it being done to human beings. What is your thoughts on that, and why is there so much controversy? If it's okay for animals, why is it not okay for human beings?
The controversy isn't necessarily so much animals versus humans, it's embryonic versus adult stem cells. And so there has been some research done on the embryonic side of things, and that's where they get into the cloning, and there are some moral issues that have to do with that. With the stem cell therapy that we're using with the animals today, and frankly, there is a human protocol, it's just not FDA approved. So they use it in other countries to great success. A lot of the sports stars and people who have, you know, the wherewithal to travel outside the country to do those kind of procedures, they're having it done on a regular basis. There are even clinics in the U.S., they're just clinical trials, but they're being used on humans as well.
Your facility is located in Tempe, Arizona. Is this the only one in Arizona? And also, are there other facilities outside of Arizona?
We actually, Medivet has a home office in Lexington, Kentucky. But what we do here in Arizona is we work with other veterinarians and we assist them to get started, to help train them, to be there on the first day of their procedures, to make sure that they know all the logistics. And then we help them with any questions that they might have afterwards.
And we're so grateful for everything that you're doing. And I understand that we can go in the back and doctor's back there and we can research and see a little bit more, right?
You bet.
Okay, let's
You
go.
bet. Let's go. This is the equipment here.
Okay, so this,
Since we're kind of here.
sure.
So basically, once they've harvested the fat tissue, they're gonna harvest it in here. Put it in here, and then we're going to mince it real fine, and then it goes into these conical tubes. We're going to add some enzymes, and it'll break that tissue down. This is a hot water bath that helps that process happen. And then periodically it'll be filtered to get any fibrous tissue that might get in the way, to get rid of that. And then we centrifuge it several times during the process.
So when you inject that into, say, an arthritic dog or the hip dysplasia, does it come back or is it a permanent?
No, well, what the stem cells do, they actually do repair, true repair, as opposed to just the medicine that kind of relieves the pain.
On it, yeah.
Right, it does repair work, but because arthritis is a degenerative disease, eventually it will start to reassert itself. How soon depends on the animal, the condition, how far along the condition is, how healthy the animal is, any number of conditions.
So
but
with that being said, would you inject it like on the very first onset? Is there a certain age or?
As soon as they start to notice that there's a problem,
That's better.
yep.
Okay.
definitely do it as early as possible. So, and because there has been some controversy about it, I think it's good to understand that there's a lot of excellent science behind this and that the science continues, the research.
You made my day, and thank you so much for the education that we have received. And if you folks out there that are interested in stem cell therapy, we'll provide plenty of video, and they can come and chat with you. Do you have consultation or?
Yeah, the doctors that do it are happy to do a free consultation.
Okay,
yeah.
So get your free consultation. Harold, thank you so much for meeting us. And this is was really difficult to get you here because what I understand is you're doing a cross-country tour on your bike.
Yes.
Is that with or without the dog?
That is with the dog. The dog goes with me.
Are you serious?
I'm serious.
Wow.
Yes.
So tell me how all this started for you. First of all, I want the public to know that you're a veteran.
Right.
And thank you so much for serving our country.
Thank you.
I am extremely grateful. So is Corey.
Thank you, Corey.
What happened?
Well, I made a phone call to the Veterans Hotline for a crisis hotline. And they said that in order for me to get into the homeless shelter, I would need to have my dog cared for. Otherwise, I'm not going to leave my dog.
Wait a minute. First of all, you're a vet and you're calling a homeless shelter?
I'm calling the crisis hotline to get into a homeless shelter.
Shame on whoever's responsible for that. That's not right. First of all, that's an issue right there. But so I'm sorry. That just continue.
Thank you.
It's so wrong.
Right. Well, so Michael, I'm talking to Michael and trying to figure out what fostering means and what that means for me. He's trying to get a document from me that means I'm letting him foster my dog, which means they will babysit my dog while I'm in the shelter. And for other vets, that may mean while they're getting hospital care, somebody's watching their pet for them.
So this company is called Vets for Pets?
Veterans and their pets.
Veterans and their pets. Well, first of all, you shouldn't be homeless, but second of all, neither should this dog. Neither should, anybody, period. So I'm just blown away right now. I'm so sad for our world, for where we're heading and what we're doing. So anyway, Vets for Pets, veterans and their pets, they take your dog.
Right. And I go into the shelter, and I had just finished visiting with my parents during Thanksgiving around that time, so I know something's up at the family, and there's an illness in the family. Well, I get a call from my sister. She says Dad is very sick, not feeling well at all. So I arrive out there, and about 3 months later, Dad passes away, February 21st. And
so sorry.
We were close. We really, for me, it was kind of, I've had a dog pass away before, and it was more difficult for me to deal with. It was his time, he lived his life, and for me, it was kind of easy to deal with for some reason. I can't explain it.
So what you're doing now is you're paying back.
What am I to do now? Dad's gone, and Mom's got some healing to do, and she's got her support network out there. There's no need for me to be there anymore. I wanted to be with my dad, and I did that. And it was kind of a blessing that I was able to be out there, not have a company to look after for, or lose my job because I had extended leave. So I decided I was going to do my bicycle trip across the country, and by golly, that's what I was going to do. And I posted it on Facebook, Tour de Peclanic. That's my dream. And what better time to do it without a house, without a job, and then to go out and do it. And somebody asked me on Facebook, what's the cause? And that's when I said to myself, I don't have a cause. What were you thinking? And I was thinking along the lines of her setting up her cause that she wanted to donate to, and I would do it. But then I got to thinking, who better do I owe than veterans and their pets? And I did cross my mind to go back in the homeless shelter and get my feet back on the ground, but then that would be another burden to veterans and their pets. So why not knock out two birds with one stone? I get my dream done, and it's no skin off my teeth by going out there and raising some money, some awareness, finding vets that are in need.
Right.
All that in one trip.
You are the epitome of taking a situation that is awful and turning it into something that is tremendous. Please take us on a journey of where you're going and what you're going to do with your turnaround situation of traveling.
Well, ultimately, I'd like to go to places where I haven't been in a long time. I've been every square inch of Arizona. I mean, I've lived here for quite a number of years. I'd like to take routes that I haven't necessarily been on. Of course, I want to be on a safe route because I will have my dog with me and traveling on the roadsides.
So where are you getting, I mean, are they giving you all of your funding, or do you need more? What can we do to help?
Well, people donate along the way. I mean, people have been in their trucks and cars and handing money right outside the window, and which is while you're riding a bicycle with the trailer, trying to grab money, and I'll give them a card for a donation receipt as well. But we are trying to pick up corporate sponsorship or maybe corporate dollar matching, where they'll match dollar for dollar what we're able to come up with along the road. So we are looking for any financial assistance whatsoever, you know.
And there is money out there, and there are corporations out there, and somebody needs to help you. Somebody needs to step up to the plate. You stepped up to the plate when they asked you to serve your country. Now they need to step up to the plate and support these veterans that have animals. So thank you for doing this for all of your fellow men and women out there who are serving our country. And we are just, I want to follow the story. So please keep in touch with the Global Rescuers. And
yeah, definitely. I like to keep a low profile with where I will be, you know, with the exception of maybe you guys, you know, who are responsible with that information.
Shot riding from Carefree, Arizona. Well, right now out of it anyway. Here you go. That's for you guys, Global Rescue.
here with Kathy from Medivet.
Medivet.
Let's do that again. It's Medivet.
Medivet.
She has trouble with English sometimes, especially this early.
Well, it's only her first language.
Thank you. Should we do the show in Spanish? Okay.
Let's do it again.
I'm trying to put Corey in a good mood.
Oh,
This
is that what
is
you're
not
doing?
about
Okay,
me. This is about him.
God
Got it.
is shining his light on you. Let's go.
Okay.